motivated your participation today here at the Global PAE Summit?
Actually, no, we are IRs. We are always opting for innovation, for newer things. The practice totally changed. I remember when I was with you training in your center in 2012, it's a totally different practice. So we are IRs. We are always for newer and innovative things. So for you, what?
First of all, I wanted to get back with friends, have some time with friends and colleagues that I really like and appreciate a lot. And of course, learn from the experts. We had the global experts all over here, like yourselves and other experts, and we can share common experience, share our own doubts, and of course push our knowledge towards the new implementation for PAE.
From last year in the PAE Summit in 2024, what do you think evolved or changed in the practice since then?
Yeah, for us it changed everything. We went from 0 to 100, so we didn't use glue for PAE, and we started, so we're now doing PAE with glue in all patients. So what about you? How did it start?
I actually changed my practice 100%. It's 180 degrees. It's from 0 to 100, as you say exactly.
I was really happy to be here, be at this global summit with everyone, with you, and I hope to see you guys again next year to be able to learn more from your experience, from everyone's experience, and also to be able to share this time with you, which is always valuable.
Yeah, it has been my honor and pleasure, as always, my friend, and I always learn from you. You never learn from me, so we have to be clear about that. I learn from him.
Garbe has always been a partner for us in IR since our inception, since our early days. And it's an evolving relationship, and I think it's getting stronger and stronger as we evolve together. And for sure, embolization with the NBCA, it's going to be a fundamental partner to have with us along this way.
How do you think PAE has evolved for the past maybe 20 years as a new frontier for the patient care, patients with BPH?
Yeah, so I think it's a disruptive evolution in medicine. So I think PAE really brought a new tool, a new therapeutical tool to help patients with BPH with lower adverse event rates and with similar clinical efficacy. So it's really a game changer. It helps us provide better patient care with similar clinical efficacy and lower adverse events. So what about you? How have you seen this evolution and change?
Yeah, definitely. If you can avoid surgery in anything, avoid long hospital stays, avoid the complications, it's always better. It's about all IR, not only PAE.
What do you think are your main challenges when facing BPH patients going for PAE nowadays?
Yeah, that's a very good question. The biggest challenges are the recurrence rates. There are always, the urologists always have new procedures, and they evolve, and usually they don't stand the test of time for many of the newer procedures. PAE, I can say it stood the test of time. However, many of the patients, when they come, they say, ask the urologist, he told me, no, this is better. So it's always difficult to convince them. And the other thing, as I told you, is the recurrence rate. So what do you think?
Yes, I think those are excellent points. I also really worried about the recurrence in long term, but also something that has always worried me were the rates of non-responders. So patients who actually don't improve after PAE, and trying to minimize those and trying to make optimized patient selection so that every patient gets a nice outcome after PAE.
See you in 2026.